Hello and welcome to Pregnancy Info. Today we will discuss that how can you find your fertile period or the days of ovulation. Finding your most fertile days and 3-step guide. Fertile days are also known as the days you are most likely to get pregnant. It's not easy to pinpoint exactly, but there are the ways to find out the days when it is most probably possible to have pregnancy. Step number 1. Keep track of your periods. How many days elapse between your period? These are the first important pieces of information to know. If you are not sure how long and how regular your cycles are, here's how to find out. Mark your calendar on the day you get your period. This is day 1. Count each day until your next period arrives, when you will begin at day 1 again. You may need to do this for 3 or 4 months to get an accurate measurement of the length and irregularity of your cycle. The average menstrual cycle is 28 days long, but normal cycles can range from 23 to 35 days in length. And of course, cycles can vary in length from month to month. Number 2. Determine your ovulation days. The key to conception is having sex during small window of time around ovulation, when a ripened egg is released from one of the ovaries and moves into the fallopian tubes. So the second important thing you need to know to point your most fertile days is when you ovulate. You can find out it according to your cycles. If you are having cycles very regular, you may be able to determine when you ovulate by doing some simple math in the average menstruation cycle. Ovulation occurs 14 days before the menstruation period arrives, or on day 14 of a 28-day cycle. So if you subtract 14 days from the length of your cycle, you will get the idea of when you ovulate. For example, a woman with a regular 30-day cycle probably ovulates around day 16. A woman with a regular 26-day cycle around day 12. If your cycles aren't very regular, then you can try some other techniques for determining the ovulation period. Number 1. Track your temperature. One of the tip-offs that ovulation has occurred is that a woman's temperature rises, or it's called basal body temperature, that will increase slightly. Your temperature every morning at the same time before get you out of your bed. If you chart your temperature each day for a few months, you will probably begin to see a pattern that will help you predict when you are about to ovulate. Most women's temperature increases about a half a degree 24 to 28 hours after ovulation. Another method is using ovulation predictor kit. This method is more expensive than tracking your temperature but may be more accurate. Available in drugstores, an ovulation predictor kit measures the level of luteinizing hormone or LH in your urine. By testing your urine using this kit, you can find out when LH levels are rising, a sign that of your ovaries is about to release an egg. Another method is to watch the changes in your cervical mucus. This low-tech method for monitoring fertility won't pinpoint exactly when you are ovulating, but it will give you some indication of whether you are in a fertile period or not. As your body prepares to ovulate, it produces larger quantities of thin, clear cervical mucus, a substance that smooths the way of the sperm to meet the egg. On your most fertile days, just before ovulation, the mucus will appear clear, stretchy, and slippery, a bit like raw egg whites. After ovulation, when your fertile days are past, the mucus usually becomes thicker, then gradually dries up. To collect a sample of your cervical mucus, gently wipe your vaginal opening with toilet paper or a clean finger. The last step is figure out when to have sex. Once you have a clear picture of your ovulation cycle, there is only one thing left to do: get down to business. This is probably the most misunderstood part of the conception puzzle. For example, if you have intercourse once you have ovulated, you may be too late. Most health practitioners advise you to have sex every day or every other day, beginning about 5 days before ovulation and continuing through the day after ovulation. This is because the sperm can live as long as 3 to 5 days inside a woman's body, and egg's lifespan is only about 12 to 24 hours. By having intercourse before you ovulate as well as on the day of and the day after ovulation, you maximize chances of getting pregnant. So this is all about the ways how to determine your fertile window or your fertile days to be ovulation, ovulated, and to get pregnant. If you find this video useful, like it, share it, and also subscribe our channel to get such informative videos from our side. Thank you.